Thank you for choosing to watch our What to Do with a Cancer Diagnosis series. Our project consists of 6 PowerPoint videos that are available both on our National Grange website and on the RetireSafe website. RetireSafe, which advocates on behalf of seniors' rights and issues, has been our amazing partner through this entire series. Bristol Myers Squibb, a leading cancer pharmaceutical firm, has made this possible. We thank them for our sponsorship and for this series. To tell you a little bit about the project, we're here to provide you with tips and instructions that you can use now or throughout a cancer journey. We see our series as a template that can be used for any condition that you may be diagnosed with. We hope this never happens to you or anyone you know, but if it does, we want you to be prepared. If you were ever curious about what to do next, what your options were, and how to get organized, our mini-series can assist you. For those that live in rural areas, we believe this series can be particularly useful as you have to be more diligent with your care because you don't really have the doctors that you need. You're further from specialists in cancer treatments, lawyers, and caregivers, and don't always have access to broadband, and you're typically less insured. Hospitals in rural areas are closing as well. We believe this information will help you prepare. As a whole, we want you to be able to share this with the people around you and with those in your community.
Thank you again for choosing to watch this series. For this section, we will be discussing how to prepare right now when you do not have a diagnosis. We created these tips so you feel less like you have to spring into action when you are dealing with a diagnosis, which is already an overwhelming time. Instead, you can do things now to alleviate the stress later.
No one can really know if they will be diagnosed with cancer or any other condition, and because of this, it may seem unnecessary to prepare for something that may not occur. However, one thing is known for sure. If you are to receive a diagnosis, there will be a lot to do in organizing documents, scheduling appointments, and choosing treatments. Additionally, you'll most likely become stressed. We want to provide you with tips that we believe will not only be useful for any medical situation, but especially in the event you are diagnosed with cancer. Some of what we will be talking about in this section is how to prepare documents, as that is something that can understandably be done before a diagnosis and is extremely useful to have at hand during an emergency situation. In future sections, we will be talking about such things as the tools to have in your back pocket. But as those are more immediate to the proverbial appointment, they will be talked of later. To give an overview of what information should be gathered and documents created, we have categorized each document into 4 groups. Something to note is that we at the National Grange and our partners at RetireSafe created a document titled Patient File Checklist. In this document, which will be easily accessible for you to have, gives a list of what you should file in advance. To encompass these documents, they have been categorized into such groups as medical history, medication list, insurance information, and legal documents. We will begin by discussing the category of medical history. In terms of a future diagnosis, you could be preparing by having a document form set aside where you will be able to keep all of your diagnosis information as it comes to you in the first appointments. For example, you can create or download a form for yourself where you can write down questions to come with, write down the healthcare personnel you come in contact with, and any upcoming tests. This, however, would be blank until the appointment, but is something worth having. But the exact information that can be gathered now is your physician contact information and documents describing your allergies and health history. The physician contact information will be needed in order to coordinate treatment plans and for a more thorough medical history analysis. This information will most definitely be asked for, and to have them written down will save you from having to think of it all when your mind is already racing from the nature of the appointment. To expand on the subsection of physician contact information, you will want to know the means to reach not only your family care doctor, but also your other doctors, like the specialists that you see. Treatment plans are dependent on a coordinated effort between all the doctors you are in contact with, as certain suggestions from your specialist or PT may be in conflict with your oncologist's ideas if they are not in contact often. You may notice that the type of healthcare professionals have been separated in this slide. The reason is due to the fact that the left grouping can be gathered now, while those to the right are the people you would be in contact after a diagnosis. What is important to note, however, is that from the beginning, you will want to be writing down the contact information of the team treating your cancer. Knowing this now may inform you to possibly bring a pen and notepad to your appointment before leaving the house. Other information that will be useful to have written down is your medication list. We have provided a document that you can utilize to write in your current and past prescriptions and any recent immunizations. While you may think that you can remember all of your prescriptions or all of your past reactions, you may easily forget one in the moment. Depending on the drug, a negative drug interaction may result if your doctor doesn't know all that is being prescribed. It is also very important to have this written, as you may be prompted to just bring all of your pill bottles to the hospital with you, but outside drugs are not typically allowed onto the premises. My grandma, for example, when she had a stroke a few years ago, brought her medicine bag with her to the hospital. The reason was mainly to save money on drugs that she already owned from being provided by the hospital, but what is important from this story is that her bag wasn't allowed in without special permission, and time devoted to getting that permission, and she did not know the names of her prescriptions off the top of her head and how often to take them. Thus, to have a list written of all of your prescriptions can prove quite useful. Knowing your insurance information thoroughly will prove useful from the beginning of a cancer journey, simply because you will want to know it just to schedule the first appointment. But from then on, with any inpatient visit, any surgery scheduled, and any drug prescribed, knowing your insurance information will be very helpful. Besides having this information at the ready in paper or digital format, just taking the time to know the ins and outs of your insurance policy will prevent you from being deceived by your insurance company. Furthermore, you have time to study other insurance plans, and if you can and want to, switch to a different one. So, you will want to devote time to understanding, say, the pros and cons of the taxpayer-funded insurance or private-funded insurance plans at your disposal. Additionally, since you do not know if and when you may be diagnosed, you will want to plan accordingly for if you receive a cancer diagnosis after you retire, as your employer-based insurance may change at that point. As such, you may want to begin looking at Medicare, for example, if you have not already done so. Knowing your prescription plan is also important, as many current cancer approaches, such as chemotherapy and immunotherapy treatments, can and are being distributed orally to reduce the problems associated with having to go to hospitals, especially for people living in rural communities who have to travel long distances, and while we're living in a pandemic where reducing exposure is very important. And this may be something worth looking into, as different insurance plans have different coverage for prescriptions. Dental and vision insurance, too, should not be neglected at this time. Some treatments are known to amplify infections within the mouth, and visiting a dentist before beginning a treatment plan is important to identify whether you have a tooth infection of sorts. Some treatments are also known to have eye-related side effects, so you should also take the time to examine your vision insurance as well. There are other insurances too that you may not have considered, and we will talk in depth about in the next slide. Many people may not know of the other insurance types at their disposal, and to learn of them now may provide you with time to invest in these plans. Supplemental insurance, as is stated, may cover some of the costs of missing work, but is usually used to cover deductibles, co-insurance, co-payments, and other out-of-pocket expenses that aren't covered in your regular insurance plan. Disability insurance is also an option if you have an aggressive treatment plan that prevents you from working. In terms of hospital indemnity insurance, this type is used to cover the expenses associated with hospital stays. Long-term care insurance is for if you may need caregiver care covered. While it may be difficult to imagine yourself in a situation where you may need assistance, if you do not need any currently, it is important to consider beforehand. Often, when you are treating your cancer, your savings may be quickly exhausted, and little may remain for the additional fees and expenses not easily thought of that are associated with cancer. Something good to note is that if you use some of these insurance types, like long-term care insurance, you will receive a tax deduction. In terms of legal documents, many can be created before your diagnosis. To name the most important documents to be knowledgeable of, there is the living will, the DNR, and the power of attorneys. Also, having the contact information of a lawyer written down will prove useful. A living will is distinct from a last will and testament, which most people think of when the term will is used. A living will is what is used when you are, just as you may have guessed, still living. Something to note is that a living will does not need to be created, as it is only created if you have stipulations about life support. If you become incapacitated but know that you do not want to be sustained by a feeding tube or ventilator, a living will needs to be made so that the healthcare professionals know to not utilize these methods. Because of the implications of not using a feeding tube or ventilator may mean death, and hospitals are obligated to do what they can to sustain life, it is important to use specific language in the living will, as ambiguous language may mean that doctors will have to use their best judgment as to what was meant. Thus, it is important to write this document with a lawyer or doctor. A Do Not Resuscitate Order, or DNR, is another document that does not necessarily need to be created, but must be created if you believe you do not want healthcare professionals to do anything if you have cardiac or respiratory arrest. A DNR, sometimes confused with a living will, is distinct not only because it has a different form and rules, but because it is dependent on your distinct death, to be unfortunately blunt. A living will is spoken of when you are incapacitated, and only with life support's absence you will die. A DNR may speak of feeding tubes and ventilators as well, but only because these are methods that may be used after CPR or defibrillators bring you back. Something to note is that it is ultimately your choice whether you want a living will or DNR, and it is understandable if you choose that route. Because a DNR and living will need to have been written before an emergency situation occurs where it becomes relevant, and it is impossible to know when an emergency situation will occur, it is beneficial to consider writing these now if you wish to have them. Another way to prepare right now, relating to these documents, is to simply start having discussions about living wills and DNRs with family members. Often, families do not agree on the topic, and to begin hinting that you may want to have a DNR will possibly save arguments later when you are stressed and dealing with treatments. A power of attorney for healthcare, also called a healthcare proxy or medical power of attorney, is used to designate another person to make medical decisions on your behalf. While this may seem a very scary concept, as you do not want to consider a time when you may not be able to make decisions or are dependent on someone, it is something to consider. As will be talked about later in this section, it is very difficult after an emergency occurs to designate someone to make these decisions, for there is a lot of bureaucratic red tape. We will speak more on this later, but just know that it saves your family time and money if you begin thinking of power of attorneys early on. With POAs, there are important terms such as durable and springing to keep in mind. Know that these terms can also apply to financial POAs as well. To explain though, a durable POA is one that comes into effect as you sign it. A springing POA comes into effect when an event that is specified within the document occurs. Oftentimes, it is some level of incapacitation that causes it to spring into effect. There are benefits and drawbacks to both, as you may not want to sign away your decisions while you are still in a state of mind where you can make educated ones. But on the other hand, springing POAs are interpretable and not always in the favor that you may wish, especially if the language within is not completely specific. A power of attorney for finances is quite similar, in that you hand over decisions about finances to a trusted individual. Without this document, it will be very difficult for your family to be able to access your accounts to pay bills in the event you are incapacitated. And, as you may suspect, bills do not stop coming in if you are incapacitated. Something to note about POAs is that you do not have to allow them to manage all of your finances, just the ones you specify, and in this way, they are customizable. I say this as a reminder, but ultimately, whether you decide to create these documents and at what point are both choices that are up to you. For the living will and DNR, take the time to decide what you want from life. Take the time to decide whether you want to maximize the days you want to see certain events, like weddings or births, regardless of the state you may be in if you choose to stay, or evaluate whether you have lived a fulfilling life so far, or if you would be willing to be in a certain state. In saying this, I am not sharing my opinion either way, as both views have benefits and drawbacks. I simply want you to consider the reasons behind each choice and evaluate which you would rather do. With the power of attorney documents, you also face difficult decisions in thinking of whatever future state you may be in and who to select to make decisions. Again, it is ultimately your choice whether you choose to create these forms, and do not allow anyone to convince you otherwise. Now, as a recap as to why to write these early, one of the primary reasons is due to the time and money associated with getting guardianship over another family member. If an emergency occurs and you are no longer able to make decisions for yourself, such as being in a coma or in some other way mentally incapacitated, and the previously mentioned documents have not been created yet, your family will have to go through a long process to be able to make certain decisions on your behalf. And this was the bureaucratic red tape referred to earlier. To alleviate some of the stress that this would entail, you can consider creating these forms now. If you do choose to create these documents, you can be using the time you have now to be putting aside money to cover the fees associated with drafting these. You can also be thinking of who you may trust to make these decisions, and whose values are in line with your own. Something else to note is that you may be eligible to have free consultations under your insurance about living wills and power of attorney documents. For all of the information that you gather in the meantime, you will want a designated place for these files. If you choose to print them, you may want a manila folder or binder to place all of these documents, and then you will want them in an easily accessible place that you can reach or someone can get to with few instructions. You may want to keep the instructions in writing on your person. You could also have these files available to you in digital format, as you are most likely to carry around your phone with you to most places. If this is the route you take, I suggest taking pictures of the documents or scanning them into your phone and creating a photo album within the Pictures app. There are also other apps that can help you write all of your information down, such as the Health app that comes with certain phones. One thing to keep in mind, however, is that certain documents cannot be used if they are simply on your phone. Hospitals place stipulations on digital files sometimes, such as the DNR. With that, this section is over, but you may be asking, what's next?